New at 5:30, we are looking into how Virginia is handling the switch to a new suicide prevention call system.
Last summer, the rollout of the 988 system looked to streamline national and state level suicide prevention efforts. Alex Littlehales walks us through what the data shows about mental health access in the Commonwealth.
1 year ago, the National Suicide Prevention Lifeline switched to the 988 Suicide and Crisis Lifeline, now only requiring a 988 phone call to get through to a local call center. So 1 year later, how often have people actually used this tool?
Dramatic increase in calls once 988 started last July over the previous 12 months.
Kurt Gleason, the Assistant Commissioner of Crisis Services for the Department of Behavioral Health and Developmental Services, says since the switch to 988, call-in takers in Virginia are seeing a roughly 50% increase in the 12-month periods before and after the switch. An increase from 50,000 calls to more than 75,000. This is based on call data across the state's 5 regional crisis centers, which includes the Region 5 Center on the peninsula. The percentage of Lifeline calls answered are up now since the switch too.
Before 988 was launched, the call centers were able to answer around 52% of the calls. Now we're up to over 92% of the calls.
Gleason notes there are still challenges with the transition 1 year later, like the system's reliance on your cell number, not location.
A national problem that needs a national solution.
988 calls from a non-Virginia number route to call centers closest to your area code, meaning people who move from somewhere else don't get a Lifeline response from their own community.
Would they know the direct contact to Virginia resources and Virginia call centers? Maybe, maybe not.
But as recently as 2020, only 2% of calls to 988 are relayed to emergency medical services. I'm Alex Littlehales for 13 News Now.
National Lifeline data shows for every suicide, there are more than 300 people seriously considering it.